which if we were just to sort of show you without, yeah, we're about there on somebody. So if you were to play along by yourself and you had a little bit of a feel, male or female, it is a little bit invasive, so we do need to make sure we have trust from our client on the table. But this can become really hot or really sore when treating. G'day guys, Darcy Ninja here from MMT. Today we're talking osteitis pubis syndrome, or more commonly known as OP, and how we at MMT treat it. Lots of us have done videos on this stuff before, but this is my interpretation and what I would do with a real life client of mine who I have seen plenty of over the years and had many successes treating. If you do like our content, make sure you do like and subscribe for more videos and alerts. Otherwise, go to our Patreon for more exclusive content. So, OP, when we're talking OP, we're talking about the pubic bone. So we're going to line this up on Ninja. So Ninja, let's put this exactly where the skeleton would look like on you. So our pubic bone is here. And you can see the cartilage in between this pubic bone here is soft and squidgy. How that is meant to act is like, I guess, a cushion, stopping friction and stopping adhesions and stopping inflammation around that area. It's meant to soften that joint. But what happens over time is we become misaligned, or we become weak in our muscles, and we have compensations in our muscles where this becomes inflamed, and friction between these two bones causes pain in our lower abdominals or in our groins. Sometimes for men we feel it in our testicles as well. How I like to assess this or osteitis pubis is, I'm going to show you guys. So what I like to do first, if people come in presenting with I suspect it might be OP, they usually have groin pain, they usually have pain just here. So what I like to do to begin with is just go through some range of motion with their hips and just having a little bit of a test passively. I'm looking for blocks or sticky points, or where we're limited in range. We always check both sides. Ninja's pretty good. I'm just going to do a fast track version. Ninja's pretty good, but if we were testing one side to the other and we went, okay, he's really blocked in external rotation on this side, or this is causing pain, yep, I can really feel pain in here. This groin actually is a little bit tighter than that one. Can you feel that? Yep. What we're going to do is put both feet up together, and then what we do is an adductor squeeze test. So Ninja would squeeze as hard as he can, and if you had osteitis pubis, you would probably get it would probably bring up your symptoms, your lower abdominal pain or your groin pain. We go wider, we do the same test, yep, and again, we'd see if this brings up that person's symptoms, if it was longer head or shorter head of that adductor. So I'm going to go to our two main points that I would like to treat, and this is why we are so successful and so renowned in Melbourne and globally for our treatment, is because we treat on the bone and around that pubic bone. So most of the time other practitioners will actually just treat down here into the groins or the hip flexors up a little bit higher where the spine attaches up on the other side, but where we like to go to is actually the pain of injury, or the pain of the site of pain, pain of injury. So what we do is, using a towel, I get actually right onto that pubic bone, which is somewhere here, which if we were just to sort of show you without, yeah, we're about there on somebody. So if you were to play along by yourself and you had a little bit of a feel, male or female, it is a little bit invasive, so we do need to make sure we have trust from our client on the table. But this can become really hot or really sore when treating. So you do need to go soft. I'm not pushing really firmly. I'm just finding the spot, pinning it and holding it like this. And what I'm doing is I'm cleaning around that bone. So I'm focusing on what I like to, an analogy I like to use, and I've used it for quite some time, is think of the tissues and the layers of the tissues and the periosteum, which is the sheath that covers the bone, or the fascia that's deep on the bone. It's like the fascia of the body, but it's what covers our entire bones. So basically what we're doing is we're trying to soften that periosteum and make it more supple, and almost clean away any little bone spurs or adhesions. So looking for those. Ninja's pretty good because he doesn't have osteitis pubis pain, but yeah.
Still feel it.
Still feel it.
There's a little bit of glands and things around here as well. So yeah, when you're treating, you push in and let those get out of the way, and then kind of since that was what Darcy was doing, I'm giving you a few words, some feedback what I'm experiencing. Feels very therapeutic and solid feeling as well. Like it's mean business. So it's therapeutic. You know it's going to be good for you.
Yeah.
Yeah, my awareness of what's going on here is just really heightened as well, because you don't know until people treat you a lot of times just what's tight, what's sore, what's restricted, and then how you feel afterwards is really good as well, because then you can feel that you move better, you run better, you lift better, or whatever it might be. You don't realise that something's holding you back until it's gone. Don't know what you don't know.
Yeah, so I've gone from an angle that was here on the pubic bone, now I'm on top of it. So if you're palpating along, you can feel the top of the pubic bone and where it's soft and where we're actually working again into those tendons and those attachment sites that go into there. Look at all, if I show you on this guy, you can see all the different nodes and shapes and where things attach onto. You know, we've got ASISs and things like that. They're probably a little bit wider out here, these two bony landmarks, but then you've got similar nodules on this guy. And look at the shape of it. So this is a pretty healthy skeleton, but for somebody that's played a lot of sport or been seated for too long, you're going to end up with all types of debris and build up, bone spurs, things like that. So we're cleaning that off. We're doing a really thorough job. All right, so as I said, I'm going to come in this way. Have a go at just working that. All right, for the sake of the video, I only want to do 2 important spots. There are other areas, as I said, hip flexors, adductors and things like that. Next, what I want to do is actually go a little bit lower and work into the lower abdominals. So if you've got OP and you're watching, I'm sure you can resonate with having lower abdominal pain. It might be on your left, it might be on your right, it might be on both sides. We're actually going to go into there, and then I'm going to pull it away.
Do you know pyramidalis, Darcy?
Pyramidalis.
Pyramidalis, darling.
Pyramidalis. What's a pyramidalis, man?
It's a little pyramid-shaped muscle, believe it or not, but it goes from the top of your pubic bone up to your navel. So it's like a triangular one. So yeah, that can be pulling on that top of the pubic bone, and what Darcy's trying to do is hook onto the side of that and then kind of drag it away a bit. So it's and the superficial abs there too, like hook onto the top of the pubic bone. So bit of Ninja's bloody anatomy.
Yeah, pyramidalis. It's a good one. Learn something every day.
Bit obscure, but it's you learn about this muscle when you deal with this issue.
So think of, with these types of injuries, think of where are the muscles pulling on the joint that can be causing inflammation or that can be causing friction on that joint. And the pyramidalis is either going to be doing that because it's really weak and compensating. So when a muscle is weak and our groins are pulling on the hip down, or our lower back muscles are pulling on the opposite side, pulling it up, causing some tilting and shifting in the pelvis, or this whole area is going to be out of whack, and what happens is the muscles generally tense up or tighten up in essence to create stability or a sense of security. And what happens is our pelvis becomes really locked up, we lose our mobility, we lose our range of movement. So the idea is, if you've got groin pain, get onto it early, because it actually can end up being something worse down the track. And chronic osteitis pubic pain is stubborn. It can be challenging to work and fix. Not so much for us. If you can get access and come and see us here in Ferntree Gully or our clinic in Richmond, we've been pretty successful over the years, certainly at curing people with OP pain. But it is easier when they've come in at the early stages of the injury. I'm going to come and do the other side as well. So I'm going to come up here, go right in deep in there, on that pyramidalis, sinking in with my fingertips. and then I'm going to get to that deep level and drag. So it might also be affecting lower abs, deep fascia, and our transverse abdominis muscle, TVA. How's that feel, man?
Yeah, it's good, mate.
It's good.
I had to go quiet to...
Yeah. Yeah, it's... When we're treating people with this sort of pain, it's something that you need to tune in and become hyper aware of how your client's dealing with it, because it can be really sensitive. It's in a spot that most people want to protect or guard that area anyway. So you going into that, you do need to build a form of trust that I'm not going to cause more pain, or I'm not going to make things worse, or I'm not going to come in too quick or sharp or hard or firm and hurt this person.
Yeah, like Darcy said before, it is an invasive area and it's sort of close to home for us, and like it's not a time to be cracking a joke. Like made the mistake before, you kind of get someone laughing when you push it into their souls or something, and there's sort of just, you can't let somebody in when you're laughing, so you got to go inside and just go through it, feel it, breathe a little bit maybe, but yeah, just feel the sensations and whatever comes up for you, because it is in your guts, isn't it? It's around that, that region of the body that's, we want to protect. So
I've actually just instinctively gone into his psoas, his hip flexor, because I'm just feeling something deep in there that I can feel a little bit of a pushback on that. So I'm just going to pin that for a moment. Yeah, our psoas could be one of the main culprits. Sometimes it's fishing and finding and looking for exactly what muscle it is that needs to work, and it can be something that you're always looking for. But what I love is finding it and knowing, there's a knowing that you're on something that's going to be productive, it's going to be helpful, you're going to be effective. Yeah. And usually, more commonly, I find it's the more painful spot, and the client usually knows it within themselves. Oh, hold that. That's it. Those little things, or they start sort of moving and like, oh, that's really fucking. Usually, we've got to go into pain to fix the pain.
Feel it to heal it, Darcy.
I was just about to go to you, man. I was about to hand the mic. What's that little saying? Feel it to heal it.
Yeah.
It's a good one.
Yeah. Little question for you, without notice, Darcy. So the MMT method and being on board with us, I think about 7 years or something now. How have you found our method and philosophy and things like that compared to probably what you learn at school and things? How's this your last 7 years been?
Yeah, okay. Obviously amazing. Otherwise, I wouldn't be here, and I wouldn't, be so passionate and so involved and just enjoy my work. Off topic, a fraction. My partner, she's a nurse, and I said to her last night, I asked her, do you love your job? Are you passionate about it? Do you feel resentment towards your job, these types of things? She goes, oh, it depends what day it is. Sometimes I do, sometimes I... And I go, okay. And I said, I don't know what that feels like. And she's like, what do you mean? I said, I'm just asking you out of, being genuine about your job and what it's like to not feel like, you really don't want to go to work today because you fucking resent it, you hate it, it doesn't serve you, you're not passionate about it. And I was asking her out of, just like, I'm unaware. I don't really know what that's like because I don't ever go to work feeling like that. So sorry to do a full circle on that answer, but it's given me guidance. It's given me a purpose. It's given me confidence in what I do, that I know that I'm on the right track by sticking to the bones and treating the tendons and going slow and going deep. And it's been no surprise that it works, because my results have been the evidence, and that's happened within my first couple of treatments all those 7 years ago. All those, I don't know, I might have treated 10,000 people plus now. So that very first fix or that third fix or that fifth fix was just like, I remember coming out of the room and wanting to speak to Ninja, be like, man, I actually fixed someone's plantar fasciitis, or I fixed someone's shoulder, and Ninja's just like, yeah, man, yeah,
cool.
like, how cool is that? Like, fuck, amazing. So, yeah, to be on board with the philosophies and be taught something that works, and have the confidence to know that you can fix people it's God's work. Yeah, it's the biggest. I can't think of the right word, but yeah, it's amazing. So, Ninja's got a course. He's about to do another intake. When does that start?
19th of February 2024. If you're watching in January, February 2024, you can join in. So yeah, you'd recommend it.
Totally, man, 100%.
Yeah, that was what I was getting at.
100% recommend.
Yeah, so it's gives you purpose and just makes you effective, and gives your life meaning, because you can change lives, you know. And like, all we're doing is we're trying to tap into the natural healing that the body can do itself. We never heal anybody. We say that we're plumbers.
Yep.
We're facilitating people's healing.
Yep.
And when you feel this, you know that things are going to change. You know you're going to heal up. We're kind of tapping into, you know, just trying to unblock gutters and pipes, and we use those analogies so the water can run. You know, that's all it is. The body just wants to heal itself, but a lot of times it just needs a bit of outside help, you know, and reassurance and things like that it's possible. Yep. So a lot of times that support is what you need as well. Like, two people working together, not one person working on you and injecting what they think. It's working together, and you're kind of giving feedback to how it feels, and let him know they're on the right track or the wrong track and things like that. And you get it done together, because like, you know in yourself when you've got pain and injury how it can be rectified.
Yep.
And if hands-on work resonates with you when you're watching videos, that's normally the way that you know that it's going to get better.
There's a calling, yeah.
So we recommend you, jump in the links and set up a chat with me and Aaron, and let's start get you fixing.
Yeah.
Yeah, it's the best.
Yeah, no, I can't recommend it enough. If I didn't say it clearly enough before, it's highly recommended, guys. Gives you purpose. You've got a true knowing that you're doing the right work and you're on the right path in life. So if you're feeling a little bit off the track, or not sure, or not enthused about the career you're in, then maybe it's time to make a change. Or you're already doing your remedial course, myotherapy course, physio. You're in this field already, but I don't know, you're just doing the same old polishing of the skin. It's not actually healing people. There's guidance. There's someone out there that can help you. That's us.
It's us.
Yeah, it's Ninja Narrow's course.
We've got a method and philosophy, but I think the biggest thing is the mentoring part. We call it a mentorship now. That we support you, and you can ask us questions in the webinars, give you lifelines. If you're local, we can help you out as well, you know, set up little study groups and things like that. So we're on a mission to get, you know, keep this art alive, you know. Too much hands off these days, too much, you know, not looking for the source of pain. We just kind of want to medicate it, pain, inject, and surgeries and things like this, whereas a lot of times it can be just a simple working with somebody, get some hands-on work, get some release happening, and the body will heal itself. Some pure exercise, get in your bare feet and do your work. It can be so simple, but it's just, it can be profound as well. So it
can be just as simple as going back to basics, but unfortunately we're so off track with what doing the 1%ers and doing the things that are truly helpful and beneficial for you, that so much of the population doesn't even know what is healthy for them anymore. Still think eating white bread is healthy. You know, just that's a whole nother example. A whole nother thing to dive into. But yeah, there will be a part 2 to this video. I'm going to go and treat the adductors and treat some other muscles that are important when healing people with osteitis pubic pain or syndrome. So make sure you stay tuned for part 2. We'll see you soon.
Get it done.